Good afternoon, my name is Gloria Gonzalez. I'm currently a DNP student at San Agustin University. In my practice as a pediatric nurse, peripheral IV access is being a challenge, and I'm presenting today the use of visualization and how these new technologies are affecting positively the success on the IV insertions. This is very important topic, and I invite you to listen to me in the next few minutes about the problem, about the PICOT question, and how the model that I selected, the current model, is being a strategy to make sure this change can be effective in our unit. In addition, we also, this presentation have the recommendations and the summary, and I invite you, all of you, to be with me for a few minutes. This presentation starts with describing the problem. 350 million of peripheral intravenous catheters are inserted in the United States annually. Peripheral IV access in pediatrics is complex. Why? Regularly in pediatrics, according to age, we have little ones with really vessels that the size are so tiny, so little, and this dispose really lack on visualization of these vessels. And in addition, we have limited palpation, and the assessment of the vein is very complex in order to determine the complexity and the difficulty of the vein access. Multiple attempts for that reason may be necessary in order to obtain a successful venous catheterization. This presentation starts with describing the problem. 350 million of peripheral intravenous catheters are inserted in the United States annually. Peripheral IV access in pediatrics is complex. Why? Regularly in pediatrics, according to age, we have little ones with really vessels that the size are so tiny, so little, and this dispose really lack on visualization of these vessels. And in addition, we have limited palpation, and the assessment of the vein is very complex in order to determine the complexity and the difficulty of the vein access. Multiple attempts for that reason may be necessary in order to obtain a successful venous catheterization. The PICOT question is the population is the pediatric patients 0 to 18 years old. The intervention is the use of the vein visualization device. The comparison is with the standard procedure without the vein finder. The outcome is to increase the success of the attempts in the insertion of the IV placement. That's the outcome, and the time is over a period of 12 weeks. Using electronic search, 3 databases were utilized: Cochrane, PubMed, and Signal. The keywords utilized were peripheral venous catheters, IV access, intravenous access, and pediatric placement. The exclusion criteria were adults and outpatient settings and articles prior to 2015. The inclusion criteria was relevant for age, pediatric patients aged 0 to 18 years old in an inpatient setting. The articles selected were from 2015 to 2020. Originally from these articles, I obtained 35 articles in Cochrane, PubMed 71, and Signal 358. Screening the articles After screening them, 343 were non-duplicate, and applying the inclusion and the exclusion, I have at the end 51 articles retrieved, and from these 15 articles retrieved, applying the full after the full text screen, 31 articles were excluded, and then during data extraction, 10 articles were excluded, and I end having 10 articles included. The evidence by Kagler shows that first attempt success rate was 46% with an average of 2 attempts and a length of 20 to 30 minutes. For CAR, the transluminant and the infrared success first attempt both displayed more than 80% of effectiveness in first attempt. The mayor, in a study in 2017, reported the first attempt was significantly higher with a 95.8% success per difficult veins graded. In the same author, Demir and Einal, in 2018, they reported a peripheral venous catheter placement success in rates in pediatric patients 0 to 3 years old as 74.1% compared with control group that was 40.7%. Goff, he reported a resource utilization where 37% of the annual cost of a 30-bed unit was utilized in multiple IB attempts. Gillion reported a vein visibility that was increased in difficulty vein access, and so she reported the first attempt success rate of 93%. This project is using Carter's model of change. This model starts as a first step with to create a sense of urgency. In this step is vital to include statistics related with patient satisfaction, with nursing performance, cost, and safety of the procedure. The second step is related with building a guidance coalition, and in this step is essential to involve leadership through persuasion. In this case also the nurse managers are very important resource, and the staff. The third step from the models, the Carter's model, is developing a vision, and the vision need to be determined by the change and the strategies. The communication is step number 4. Communication of the vision can be through planning meetings, through shared governance, to daily energizers, and to continuous email communication. The enable action is definitely empower others to add, to be able to be a good team member, and to provide autonomy to the human resources who are involved in the project. The number 6 is to generate a short-term wins. It means to recognize the good job that individuals who wanted to participate in the project are accomplishing. The step number 7 is to sustain the acceleration. So everything that was built needs to be endorsed and maintained to the different steps of the change. And to institute change is extremely important to create the team culture towards the new change. And in this project, implementing this project in a unit will require the educator input, the nurse manager, the nurses, the staff involved in nursing, and in this case also the pediatric patients and the families. Thus, this Carter model of change will be very beneficial to the patient, the family members, and of course the organization, and in addition to the nurse performance. The first measurement is the average of number of successful attempts in peripheral intravenous insertions. The tool is the electronic medical record available in our organization, and the information that I'm looking for is how many attempts per successful IB and if the visualization device was used or not. The t-test will be used to compare pre and post measurements and percentage. Results, I'm looking for increase of the first attempt success rate. The second measurement is the average cost per intravenous insertion per attempt. The tool is the unit database related with cost analysis. T-test will be compared pre and post measurements, and the results are to determine the cost per attempt and cost per successful attempt in 90 days. The third and last measurement is the length of time to successful IB placement and the number of the attempts. The tool surveillance to determine the length of time per successful IB. Correlation coefficient P, and the results are to reduce the time for the procedure. The plan for the dissemination of the evaluation of the evidence-based project change includes different institutions, some of them locally. So locally will be the hospital through the Chair Governance Committee, the Educational Department, the Safety Committee, and through pediatric leadership team and the key stakeholders. Just more national and international. National could be Sigma Theta Tau, Infusion Therapy NURS, and publications could be Infusion Therapy Nursing Journal, Journal of Pediatric Nursing, and Pediatric Emergency Care Journal. The use of the visualization device reduces the time of operation, increases the first attempt success, and decreases the number of attempts of the IB access insertion. In addition, this adopting the visualization technology devices as part of the routine procedure used by nurses during the assessment and selection of the peripheral IB site help by detecting the vessel and aiming the procedure towards success of the peripheral IB catheterization. In conclusion, the pediatric peripheral IB success are increased by the use of the visualization technology. The evidence shows significantly that the success in the first attempt is increased using the visualization technology, the procedure time is decreased, and the attempts are decreased. The steps to create this climate for change are based in Cutler model of change, and in this way the organization are engaged and is able to implement and sustain the change. The intervention is the adoption of visualization technology devices used by nurses during the assessment, selection, and detection of the vessel, and aiming the procedure towards success of the peripheral IB catheterization. The dissemination will be spreading the word by many routes, and the conclusion is that the using technology visualization devices as part of the nursing routine will support the success in the first attempt and the time reduction of the procedure and the success of the IB procedure. If you have any questions, please let me know. Thank you so much for listening to my presentation. If you have any question, please let me know. Have a wonderful evening.